What is the definition of the word goiter? The word goiter is totally synonymous with the word enlarged thyroid for any reason. If you can remember from your histology, and I know you don't have any trouble recognizing this as thyroid because there's nothing else in the body that looks like this. Epithelial-lined follicles filled with this proteinaceous material called colloid. Most normal thyroids have follicles that are fairly uniform in size with some variation, but they don't get this big. These are enlarged follicles. These are actually cause the thyroid to have a nodular configuration, and if the follicles are enlarged because of this colloid material, I guess the word colloid goiter would be appropriate here. This does not in any way imply that the thyroid is overactive or neoplastic. It's a very, very common condition, and morphologically, whenever you see an enlarged thyroid, be it nodular or not nodular, and microscopically the follicles are enlarged with increased numbers, an increased amount of colloid, you could very legitimately call this a colloid goiter. If for example, a goiter was also associated with hyperthyroidism clinically and overproduction of thyroid hormone, you might want to call this Graves' disease if the goiter was uniform, or perhaps Plummer's disease if the goiter was nodular and it was actually the nodules that were producing the increased hormone. But we'll talk about that another day. As long as we have a high power here, let's zip down to one of these follicles just to verify the fact that these large colloid follicles are lined by this relatively cuboidal thyroid follicular cells. Thank you very much.